Okay, so good evening, everyone, and welcome to the 2007th episode of the Uninterrupted webinar series of the International Forum for Promoting Homeopathy. I am Arya. I'm a third year student from ANSS Homeopathic Medical College, and I'll be your moderator today. And today we are honored to have our guest of the day, Dr. AMRUTHA MANOHARAN, uh, 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 BHM is MD, and she has had several qualifications, including diplomas in yoga, naturopathy, clinical cosmetology, a PG diploma in geriatric medicine and hospital administration. And she is also a former research fellow from a National Health Research Institute in Mental Health. So, and today our topic is a very significant one, which is menopause. It is a significant physiological transition in every woman's life, including physical, emotional, and hormonal changes. So, homeopathy, with its holistic approach, is having huge chances in menopause and in managing the symptoms of menopause, of course. And so, I welcome Dr. AMRUTHA MANOHARAN. The stage is all yours, ma'am.
So good evening, all. Thank you, Dr. Arya.
And you can start screen sharing.
Please open your video, right?
Yeah. Yes, ma'am. Now it's visible. But your video is still not on, I guess.
I will open the video after presentation, right?
Okay.
So good evening, all. First of all, I thank God Almighty, my respected parents, and my respected teachers, and humble pranams to our beloved master Samuel Hahnemann. So, as always a student of homeopathy in the past, present, and the future. So today our topic is about menopause and homeopathy. So this topic is very much important as far as we are concerned because as the age is advancing, as the clinical condition and the clinical treatment is much more advanced in all over India, all over world, and also in Kerala, the life expectancy of persons living in the country are been rising at a rapid level. And when we are getting an analysis of CDC data, there are about 103 million persons who are in the menopausal age group. So menopause is a area which we can provide great scope. That is, we can. There are many conditions. So today, in today's section, I only deal with the different conditions of the menopausal period, and after on the upcoming sections I will be including the case series and also case presentation of different conditions. So when is the world menopause day celebrated? Anyone? When is the world menopause day celebrated? Each and every health days are there. So when is the world menopause day is observed? So it is usually observed on the October 18th. Okay. So menopause is a time period. Before starting, in the lifetime of a woman, three phases are usually being celebrated. So first one is the birth of the child as a girl child, the birth of the child. Second, during the period when the child attains the first maturity or the menarche. And the third phase is the after the marriage and the childbirth. These are the three phases that has been celebrated. But menopause is mostly not celebrated or not be noticed even by the lady also. Okay, that sort of time or the that menopausal period is much more important as far as a woman's life is concerned. What much important we are giving to the menarche time or the delivery time or the pregnancy time, that much importance we are supposed to give on the menopausal period also. So menopause marks the permanent cessation of menstruation due to loss of ovarian follicular function and a steep decline in the circulating estrogens, especially the estradiol. It is typically occur between 45 to 55 years of age, though surgical and medical interventions can bring them earlier. Okay. So, when there is absence of menses for a one continuous 1 year, then we can call it as a menopausal period. In modern age, most of the females are been having different types of disease like fibroid, then some cysta there, complex cysta there, then thickened endometrium, and there are different conditions affecting the female reproductive system. So in case of fibroid, when there will be severe bleeding will be there, usually the physicians, apart from homeopathy doctors, the other physicians, when the patient is approaching the other physicians, they will be saying that, so we can do myomectomy, or sometimes they will be saying we can do myomectomy, that is a removal of fibroid only. Sometimes they will be insisting in removal of the whole uterus. Okay, that is one reason why the menopause, that is the menses, stop and the menopause occur earlier. This is one reason. And next, one of the important reason is the premature ovarian failure. Okay, premature ovarian failure usually occurs when the menopause attained before 40 years of age. It is due to some hormonal imbalance and also some viral infections and also some other source of treatment. So these all conditions are to be differentiated from the regular menopause. So menopausal stage begins 12 months after the final menstrual period, and the signs, we can see the signs in the physical level, psychological level and metabolic level. So this is the epidemiology, that is the menopausal age group. So we are having an advanced treatment, and most of the life expectancy has been gradually increasing. So in India, there is about 103 million persons who is on the menopausal age group. So usually we diagnose menopause by the signs and symptoms, and in spite of the signs and symptoms, there are some other markers. Okay, some biochemical conformations are there, and the biochemical conformations are supposed to do when they are in needed case. Okay, mostly the FSH, the follicle stimulating hormone, the normal value will be from 30 to 40. The level will be rising above 30 to 40. Then next one is the estradiol and the estrogen. The level will be less than 20. Then one of the important hormone is AMH, or the anti-Mullerian hormone. This hormone is very important in case of the reproductive age group female. When the lady is having some PCOD conditions like that, the doctor is supposed to test this AMH level. Okay, this AMH indicates the amount of ovum that a woman can produce in their lifetime. So as we all know that the amount of ovum will be more, the oocyte, the primary oocyte will be more when we are in our mother's womb. This will be more than about 5 lakh, 5 million. And after when our birth is there, after it will be steeply decreasing to 2. Then on further age, as our age advances, the follicle and the ovarian reserve will be decreasing and ultimately lead to the ovarian load reducing, and it will lead to the menopause. So the physiological basis of menopausal disorder, first one is the hormonal change. The hallmark of menopause is estrogen deficiency coupled with the elevated gonadotropin level, that is the FSH and LH, and there is a lack of negative feedback. So before saying this, our brain in our body, it is mainly maintained by the hypothalamo pituitary ovarian axis. So the hypothalamus, it release hormone, it release to the pituitary, it release the then anterior pituitary, it release the FSH and LH. In turn, it on the uterus and ovaries, it release the estrogen. This is having a positive feedback mechanism in the body. But what happens is that in case of menopause, there occurs a estrogen deficiency, and as a consequence of estrogen deficiency, the FSH and the LH level will be rising. So the key factor in this menopausal age, menopausal complaint is the estrogen. Okay, estrogen is one of the very important and essential hormone as far as a female is being concerned, and estrogen has action on regulation of the bone metabolism, lipid profile metabolism, vascular endothelium metabolism, and then vascular endothelium function, and also the thermoregulation metabolism of the body. So when we are going to the further section, we can analyze that each and every condition in our body occurs mainly due to the lack of estrogen deficiency only. And also the estrogen has an important function on the osteoblastic activity and osteoclastic activity. So and also it help in reducing in the lack of estrogen in turn will cause reduced bone mineral density, which ultimately lead to osteoporosis and other changes. So this is the estrogen. There will be lack of estrogen in the body of the female. and the lack of estrogen will create all the sorts of complaint. So we can go with the different systems of the body. So first one is the reproductive and the genitourinary system. So the most common symptoms include vaginal dryness, burning, itching, dyspareunia, that is a painful intercourse, along with the vaginal atrophy, recurrent urinary tract infection, and increased frequency of urination, incontinence of urine, and pelvic floor weakness. As far as a woman is being concerned, the reproductive system is much more important. Okay, so that is why this reproductive system is being included in the first section. That the estrogen deficiency is the key factor behind all these conditions. The vaginal dryness and the burning, itching, dyspareunia, all this is mainly happen due to the estrogen deficiency. We can see how this occur. So these are the main women's reproductive complaints. That is a recurrent urinary tract infection will be there, frequent urging to urination will be there, pelvic floor weakness will be there, there will be dyspareunia will be there, vaginal atrophy will be there, and vaginal dryness will also be there. So the main pathophysiology is thinning and atrophy of the vaginal epithelium and the urethral epithelium. Mainly, all this is controlled by the estrogen level in the body. Ultimately, it leads to decreased elastin, collagen, and also the vascularity of the region also decreases. And normally, our vagina is being protected by an organism known as lactobacillus, okay, which gives acidic pH to the vagina. So, the pH also during the menopausal age group, the pH is also altered, and the area is susceptible for infections. The commonly used medicines include sepia, laxasis, belladonna. So sepia mainly for the vaginal dryness and bearing down sensation along with the mental picture. Laxasis, there will be intense heat. The hormone due to the hormonal imbalance, there will be intense heat. And belladonna for the acute burning congestion. And then creosote is one of the important remedy for the offensive discharge with intense itching and dyspareunia. So causticum is important medicine for the stress incontinence. Then one of the important and rare medicine is fagopyrum. So the fagopyrum, it is mainly the indication is pruritus analis, that is pruritus of the vulva with yellow leukorrhea and burning in right ovary. Then external wash we can use calendula tincture, curcuma tincture, and hydrastitis tincture for wash. Next is dyspareunia and sexual dysfunction. There will be loss of lubrication and vaginal narrowing, and these psychological factors contribute to the painful intercourse and reduced libido. So most of the cases, that is, when we analyze the current situation, most of the women of the post-menopausal age will have most of the psychological issues, okay, depression like that, psychological issue, and also the problem between husband and wife in the old age group. One of the critical reason is this area of the reproductive age group, okay. Normally during the premenopausal age, although during the lifetime they will be having a good relation with the husband and wife, but during the menopausal age group, the woman's interest in the so-called activities will be reducing, and this ultimately lead to some problems in the family. Okay, this is also one of the area when we are doing some counseling like that sections. Sometimes the husband and wife will be saying that they will be they are having no problem with their lifetime, but due to some this type of reason, they are having some separations between the husband and wife, and some problems between the husband and wife also. So in that sorts of case, we have to give a counseling to the husband also. Okay, the wife is suffering from this menopausal complaint. She will experience such and such of sorts of symptoms, and then also you can give the constitutional medicine and also counseling to the patient, and also supportive treatment. Okay. As a homeopathic medicines include Agnus castus, there is marked loss of sexual desire with physical weakness, selenium for the sexual exhaustion and weakness after intercourse, platinum mainly for the hypersensitivity of the genital organs with mental arrogance and depression. Next one is the uterine prolapse and the pelvic floor weakness. There is atrophy of the pelvic tissue and the loss of muscular tone lead to varying degree of prolapse. Okay. Regarding prolapse, the common one of the exercise using is the Kegels exercise for the pelvic organ prolapse. Many other exercises also there. This Kegel exercise is one of the most important thing. Then next one is use of pessary. Okay, we are not supposed to do use any pessary, but we must refer the patient to some gynecologist for the pessary treatment. Uh, then the next one is important homeopathic medicines include sepia. It is one of the classical remedy for uterine prolapse with the dragging sensation. And delium tick, the sensation of pelvic organs would escape also in standing, and calcarea car with the prolapse associated with the obesity and weakness with the metabolic imbalance. So I have a case of menopausal prolapse of the uterus of a 72-year-old lady. She was coming to the OPD for she is saying that there is something coming out of her genital area when she was trying to urinate. She also have history of cough before that, continuous cough before that, and after Sepia, one medicine was given. Sepia one was given weekly along with blank tablet, and after 2 months the complaint has been relieved. The patient is not having that's also complaint like that. Next is recurrent urinary tract infection. So postmenopausal women experience frequent urinary tract infection due to mucosal atrophy and altered vaginal flora pH. This I already mentioned before. That is due to the lack of estrogen. There will be vaginal flora. There will be decreased vaginal. The increased vaginal pH will be there, and increased chance of infection will also be there. The most commonly used homeopathic medicines are Cantharis for the intense burning pain, then Staphysagria for UTI following sexual activity or emotional suppression, and Epis for the burning stinging pain with the Scandiol. Next one is urinary incontinence. Okay, urinary incontinence mainly due to the estrogen deficiency that reduces the tone lead to the stress or urge incontinence. So this is the one of the most important areas because during the postmenopausal, that is their retirement lifetime, right? And the postmenopausal age, they will be having some tour or traveling like that. And many persons, many women of the menopausal age group, when they are having this type of complaint, they will not be in a position to travel for some long distance also. Even when they are traveling, their thing come into the mind is they have to pass urine. So such type of an incontinence will be there for the patients of this age group. The commonly used homeopathic medicines include causticum for the stress incontinence on coughing or sneezing, and pulsatilla for the involuntary urination with the hormonal and emotional imbalance, and equisitum for the constant urging to urinate along with the sensation of fullness in the bladder. This one is dysuria and urethral syndrome that we already mentioned. Saxaparal and Tuja is one of the main medicines, and most of the time go with the constitutional medicine and also single medicines. There are many companies available in homeopathy along with some patent products. So just Paxon 77 climatic drops is there. Then Paxon leukoid tablets will be there. Pelviate tablet which is for pelvic discomfort. Then Vilvoshaba number 13 is one of the important medicine for burning sensation in the vagina. Then Similia loco syrup is also important. So till now we were discussed about the important condition that is menopause. It is one of the important conditions when as far as the life of a female is being concerned, and there are many signs and symptoms during menopause. So just we can rapidly brush through the initial slide. So menopause is the permanent cessation of menstruation. It can occur earlier due to some surgical innovations and also some infections or increased amount of some hormone intake medicines. For persons with a psychiatric complaint, when they are taking some psychiatric medicines, it will also lead to the early menopausal symptoms and early menopause. Then menopausal stage begins 12 months after the final menstrual period. So in India, about 103 million, we are having 103 million menopausal women, and mainly it is diagnosed by the clinical symptoms and also by the blood parameters like FSH. There will be raised FSH, decreased estradiol, and the AMH level also will be reduced. Then All the changes in the menopausal age group is mainly due to the estrogen deficiency. Then we deal with the genitourinary system. There will be dryness of the vagina, dyspareunia, then vaginal atrophy, recurrent urinary tract infection will be there. Frequency of urination will be more, and pelvic floor weakness will also be there. Main reason is that due to decreased estrogen, there will be thinning and atrophy of the vaginal and urethral epithelium, and there will be decrease in the elastin and collagen content in the body, especially on that region, and there goes to loss of tonicity and elasticity of the region, and increased pH of the region lead to recurrent infections. We have already mentioned the medicine. Next, we will be dealing with the next system, that is the musculoskeletal system. So, as I already mentioned that this estrogen is having an important role in the osteoporotic activity and also the bone mineral density regulating activity. Okay. Osteoporosis means there will be decreased bone mineral density, and the patient will having nowadays there is a bone mineral density checkup, free checkups is also available, and in which we will be standing or sometimes standing or sitting in a small machine, and it will be giving an idea about the bone mineral density in our body. Next is the joint pain and stiffness. Next, backache, muscle cramps will be there, and increased risk of fracture will be there. There will be osteoporosis will be there, back pain will be there, then muscle cramps will be there. Then muscle cramps may be due to the decreased calcium content in the body. So why there occurs a osteoporotic changes or the bone changes in old age? Because the level of estrogen will be reducing sharply, and the bone resorption, the bone breakdown will be at a higher rate. So usually bone mineral density test is being done, and also one of the important gold standard test is DEXA scan. Okay, in DEXA scan is one of the important scan, and in that when the T score is less than 2.5, we can claim the patient is having osteoporosis. Okay, when we are doing DEXA, that is a dual energy X-ray absorption test, when the T score is less than 2.5, we can say that the patient is having osteoporosis. And when it is between -1 to -2, it will be osteopenia. When it is less than or equal to -2.5, we can consider this to be osteoporosis. So, mainly by the dietary management, we can advise the patient to take increase the calcium-rich food items, vitamin-rich food items, and advice for getting adequate amount of sun exposure. So, pathophysiology, the loss of estrogen accelerates the bone resorption, decrease the bone mineral density, and alters the calcium metabolism. Okay, when there occurs a reduced estrogen level in the body, it increases the bone resorption there, and also reducing the bone mineral density and calcium metabolism. There will be osteoclastic activity will be increased. Osteoclastic is the bone destroying activity will be increased, and osteoblastic, that the bone formation activity will be reduced, which all ultimately lead to sarcopenia, that is the reduced muscle mass and muscle strength. Along with it, the level of collagen in the body is also decreasing. So there are many medicines in homeopathy. So first one is calcarea carb, mainly for the bone weakness, easy fatigue, and a tendency to obesity with a profuse sweating. Next one is the calcarea force, mainly for the bone pain, delayed healing, weakness after menopause. And silesia is one of the many important medicine for the fragile bones and poor mineralization. Then rustox for the stiffness, and symphytum for the fracture healing and bone regeneration. So calcarea force usually given in 6x potency. Silesia also in 6x potency. Then calcarea carb, if it is a constitutional medicine, then 1 potency is also very effective. And rustox and symphytum, it is usually given in low potencies, 30 and 200. Next is osteoporosis. Osteoporosis means the density of bone decreases in old people and particularly marked in women after the menopause. So in osteoporosis, there will be thinning of the bone and easy fracturing of the bone. There are many important medicines like calcarea calf, calcarea post. Calcarea calf, there will be pain and weakness in the back, especially lower back and curvature of the upper part of the spine. Then calcarea post, there is weakness, pain in legs and also the sciatic pain. Silesia is also one of the important medicine for fracture and osteoporosis. This one is symphytum. Next is osteoarthritis. So each and every condition in this menopausal age group is a vast condition. Okay, they can be deal with any separate section. But as we are concerning the main symptoms in the post and the menopausal age group, we are having a rapid go through in each and every sections. So osteoarthritis, it is one of the degenerative joint disease that becomes rising in menopause after due to estrogen deficiency and also due to the cartilage degradation. There are many important medicines and osteoarthritis we can see osteophyte formation will be there. There will be reduced joint bone space will be there. When we are taking X-ray, we can see the osteophytic activities will be there, and osteoarthritis is one of the important degenerative joint disease. So mainly, it usually occurs in female above 50 years of age. Mainly the wear and tear and the weight-bearing joints of the body is been affecting. Obesity also plays a important role in this osteoarthritis. Then mostly the knee joint is being commonly affected. Knee, hip, and spine is commonly affected. There will be pain with the morning stiffness will also be there. Then we can manage with the homeopathic medicines like calcarea calf for the osteoporosis in stout, fatigued individuals with the poor calcium metabolism. Then calcarea force for the bone weakness with the delayed repair and general debility. Silesia for the brittle bones and poor assimilation with the chronic weakness. Symphytum for fracture, mainly for the healing of the fracture. 30 potency is also effective and also tincture potency is also effective. Then medicines according to different companies. First one is Vax and FlexiCare is available. It is one of important medicine. Then calciite tablet is there. Then compound 5 drops for arthritis. Then Wilma Schwab root pain drops. Then Similia 500 tablets. Lumbago syrup. These are the combination products available. So mostly when we are going with the constitutional medicine, it will be giving much more relief. And also our commonly used oils like arnica, arnica, rustox oil also works. Next important system is the cardiovascular system. So as I already mentioned that cardiovascular system is also one of the important system in the this age group. Why? Because our estrogen, as I already mentioned that our estrogen in the body regulate the level of LDL and also it has the cholesterol level in our body the vascular endothelium. When it is having action on the vascular endothelium, there will not be any clot formation like that, and the blood will be continuously flowing in the vessels, arteries, and also in the brain, and there will be no problem with the obstruction or any leakages or any discomfort. But when the level of estrogen in the body is being decreased, there occurs an irregular imbalance in all these factors. Mainly it is manifested as hypertension, palpitation, atherosclerosis, and there will be increased risk of coronary artery disease and also ischemic heart disease. There will be palpitation will be there, muscle cramps will be there, increased heart attack and increased risk of stroke will be there, Blood pressure will be high, cholesterol will be high, and chest pain and angina will be the other symptoms. So, ischemic heart disease is one of the symptoms. There's the loss of estrogen predisposed to coronary artery disease. So the clinical manifestation is chest pain or discomfort, breathlessness on exertion, atypical angina symptoms, and reduced exercise intolerance. These are the main symptoms. The patient will be experiencing most of the case. Nowadays, most of the cases asymptomatic when the patient only present with the dyspnea on exertion or dyspnea on a slight movement, and when after that only we will be having some regular checkup like the cholesterol checkup like that, because in most of the time the lifestyle pattern of the patients persons in the country is been changing. Okay, most of them are being addicted to fast food and increased fat content in the food. This is one of the reason. Dietary reason is one of the reason, and next one is the lack of exercise activity and stress, etc. Also provide the next symptom is dyslipidemia. Altered lipid metabolism result in elevated LDL and triglyceride level, contribute to the atherosclerosis. So HDL is the good cholesterol. HDL, only HDL is the good cholesterol. Then LDL and triglycerides are the bad cholesterol in the body. When there occurs any increased in level of this hormone, it will lead to hyperlipidemia. As the palpitation and arrhythmia will be there, then irregular heartbeat along with the awareness of the heartbeat and anxiety. Then when we are looking for the peripheral vascular complaint, there will be reduced vascular tone. It may cause cold extremities, leg cramps and varicose vein. So in nowadays, the incidence of varicose vein is been rising at an increased rate. Apart from being a varicose vein only, sometimes it may predispose to varicose ulcer. And in our OPD, when we are dealing with the conditions of varicose ulcer, the incidence of female patients with the varicose ulcer in post-menopausal age group is being at a increased level. Okay. So the main pathophysiology is estrogen has a vasodilator and also the lipid regulating effect in the body. When there occurs deficiency of the estrogen, it leads to the endothelial dysfunction and dyslipidemia. So we have many medicines. So first one is lac acid for the circulatory disturbance during menopause, hot flushes with palpitation, left side cardiac complaints, and aggravation from heat and tight clothing. Glonoin for the sudden surging of the blood to the head, throbbing headache with palpitation, hypertension, and flushing. One of the important medicine is Crataegus. Okay, Crataegus in boric it is been mentioned that it has a power to dissolve the crustaceous deposit on the arteries. So mainly for the functional and organic heart with weakness of the heart, dyspnea and oxidation, it is a supporting medicine for ischemic heart disease. As well as characters mainly, there is a sensation of constriction around the heart, angina-like pains will be there, palpitations with anxiety will be there. Digitalis, the pulse will be slow, weak, and irregular. Heart weakness with faintness will be there. The symptoms will be aggravated from least motion. Spigelia for the neuralgic pain and also the cardiac pain. With the pain worse from motion, left side chest complaint is there for spigelia. Next to Oromet, it is one of the important medicine for post-menopausal and menopausal depression. Okay, the family during their lifetime, the mother or the grandmother will be working for the family, and during the menopausal age group, the mother, the son or the daughter or the in-laws will not have any good relation with this patient, and most of the case they will be sending to some old age home or some woman helpline places, and in most cases they will be having severe depression. So when we are talking with the patients in this old age home, most of the time they are being in a situation that they are being depressed not because of their illness, something like that. They are being depressed because the person who she thinks uh, they are very important for her in her life has sent her out of their comfort zone, okay, to a place where she is totally unknown. And in most ultimately some cases along with the depression they will have a suicidal tendency like that. And in that case oromate has a wonderful action. Then hypertension with suicidal thought and sensation of great responsibility and despair, along with cardiac disease associated with depression. This oromate is one of the important medicine. For one case, I have given one potency, oromate one potency in a cell, and that case shows marked improvement. The level of depression has been changed. So when we are analyzing with the Beck depression scale, the level of depression is being gradually reducing monthly. When we analyze with the monthly, there is a gradual reduction in the depression level of the patient. So next is Baxen 5 gold drops. This is a primary formulation for the cardiovascular support. Then B4 heart drops. Then Wilma Shawe Essetia Ora gold drops. Then SBL Tonicardia gold drops. Then Bioforce Complex 26 cardiac drops is there. So why I'm insisting this company name, etc. like that is, in this today's modern age, the patients are being using AI and other technologies to get more advanced about. They are being more advanced than us in some case, and they will be saying that after I have bought this medicine and I am eating this medicine, so can I continue this medicine? Just like that, they will be saying. So in that situation, we will not be saying that no, no, I don't know, like that. Just for getting an understanding, I am saying this company name drops like that. So in some cases, that is Essentia Aura Gold Drops. I am using this Essentia Aura Gold Drops. This is having some much more important effect in the, along with the controlling of the blood pressure. And one of the important medicine is the Beratamur. There is a systolic, high systole with a low diastole. Thus, Beratamur is one of the important medicine. Along with our Ravolfia. So the thing with Ravolfia is there's a component known as reserpin is there. There is a research activity has been done on the reserpin. That reserpin is supposed to be a trigger for Parkinsonism and other neurodegenerative condition like that. So when we are giving Ravolfia tincture to the patient, be sure that when the level of BP level is being decreased, decreasing when through a regular checkup, we must be sure in reducing the drops. Okay, reducing the drops to such an extent that it will not cause any harm to the body. Okay. Next is the nervous system. In nervous system, the most common important complaints include hot flushes, night sweats, sleep disturbance, headache, migraine, and paresthesia. So menopause, when we are supposed to hear the word menopause, one of the important symptoms that came to our mind is the menopausal hot flushes. Okay, why the menopausal hot flushes occurs is mainly due to the estrogen deficiency in the body. So estrogen deficiency is one of the trigger behind the menopausal hot flush. Then some sleep disturbance will also be there due to the hormonal imbalance in the body. So, as I already mentioned that estrogen is one of the important hormone in the body which controls the many activities in our body. So this estrogen is also having action on the GABA, that is GABA butyric acid, and also other neurotransmitters, dopamine and serotonin in the body. And when the level of the circulating estrogen in the body will decrease, it ultimately lead to the defect in the neurotransmitter mechanism in our body, and which it will lead to this all type of complaint in the body. So there will be headache will be there, then migraine will be there, then sleep disturbance will be there. So it is evident from the fact that when there is a sleep disturbance is there, it ultimately lead to migraine, headache, and other complaint. Then there will be hot flushes will be there, then chest pain, paresthesia, that is abnormal tingling sensation will be there. One important thing is the menopausal cognitive function, which can say menopausal brain fog. Okay, there will be poor memory in most of the case. They will be having a poor memory. Usually, they will be forgetting the day-to-day. And usually, they will be forgetting the things that they are being kept where. Okay, they will have and also the frequent reduction in memory will lead to the name. Okay, they will be forgetting the name of some important persons or forgetting where they are kept the things, etc. like that. So it is the menopausal brain fog. Then poor memory and poor concentration along with the reduced mental activity and reduced mental clarity. Next is mood disorders. Okay. Next one important thing is mood disorder. In postmenopausal women, there is an increased risk of anxiety, depression, and emotional lability, along with the irritability and mood swings. All this is being mediated by the neurotransmitter level in the body. As I mentioned earlier, that the dopamine, GABA, serotonin, all this is being also controlled or influenced by the estrogen level in the body. When there occurs a reduced estrogen level in the body, which automatically reflect all these hormones, and the reduced and the imbalance in the level of hormone will lead to the mood disorders. Next is sleep disturbance. The most common complaint include insomnia, frequent nocturnal waking, non-restorative sleep. There will be non-refreshing sleep will be there. Then early morning awakening will be there, and uh, and there will be alteration of the circadian rhythm in the body. Then headache and migraine. The hormonal fluctuation also trigger headache and migraine. Tension headache will be there. Then migraine without aura will be there. Increase the headache frequency or severity will be there. Then on the peripheral nervous system, we can see paresthesia or the tingling or numbness sensation. Mainly occurs due to the deficient in calcium and vitamin D level in the body. So burning sensation will be there. Restless leg syndrome will be there. There is a restless leg syndrome. Another name is Gowans food syndrome. It also occurs due to the thiamine deficiency in the body. Then increases sensitivity to pain. Okay. Suppose when the grandchildren are being stuck in there or touching them, they will be feeling intense pain and which ultimately lead to the irritation of the patient. In that case, arnica is one of the important medicine, cannot be touched and that sort of complaint. Next, pathophysiology is estrogen. Estrogen influences the hypothalamic, thermoregulatory, and neurotransmitter balance in the body, and it decrease in causes vasomotor irritability. On important medicines like Califos, mainly for the mental exhaustion, memory weakness, nervous breakdown, insomnia due to mental overactivity. Sepia for the indifference to the family, depression with irritability, mental fatigue, and sleep disturbance. Ignitia, it is one of the important medicine for long continued grief, that is emotional instability, anxiety, grief, mood swings, and sensitivity to stress. Lacquers mother for the hot flushes, mental excitement, loquacity, insomnia, and anxiety and suspicious. So lacquers is also one of the important medicine that our pioneer Dr. Ken's wife was suffering from persistent insomnia like that, and Dr. Phelan has given lacquers for her insomnia. So lacquers is also one of the important medicine for sleep disturbance. Next one is the calcarea carb, mainly for the mental sluggishness and anxiety about the health, poor concentration, and sleep disorder. Simsifuga, this is medicine, commonly Simsifuga is given in a maniac depressive cases. Okay, maniac depressive psychosis case, the Simsifuga racemosa or Actia racemosa is one of the important medicine, mainly for the nervous irritability, headache, and sleeplessness with rising thoughts. Calcarea carb for the mental sluggishness, anxiety about the health, poor concentration. Then one of the important medicine is Avena sativa tincture and also ginkgo biloba tincture. Avena sativa tincture for the weakness and usually given for weakness, and ginkgo biloba. The doctrine of signature of ginkgo biloba is it is just looking like the brain like that. Two lobes of the brain, just like that it is been saying. So it is very much important for the memory weakness of the old age, one of the important medicine. Next, anacardium is also one of the important medicine for memory weakness and old age this condition. In anacardium, we can see marks also of rage. Okay, rage will be there in anacardium. Then Brahmi is also important medicine. Brahmi is usually given for children, but it is also uh, Brahmi is some sorts of relief. The Brahmi is given for this weakness of memory. Mainly for it is having a calming effect on the mind. Then psychological emotional system, there will be depression will be there, anxiety will be there, irritability, mood swings, and memory disturbance will be there. Then depression, anxiety, mood swings, irritability, memory influence, memory disbalance will be there. So in all this case, in case of anxiety, in case of depression, we can assess all this by using some scales are there. And on further session, we will deal with the depression, menopausal depression, and the skills and the way to analyze it. So, in menopausal age group, when the patient is coming to us, we will be giving a screening with some sorts of questionnaire and some international and also the classification of the depression is there. When we are giving questionnaire to the patient is asked to fill each and every questions are there, and after that only the patient is being analyzed for the depression rating. Then and after further treatment, we will do the depression and anxiety scale for 3 months. First 0, then 3 months, then 6 months. This is the three interval, and then we compare with the first one to analyze the improvement. Along the counseling, it will be doing a great deal. Next, pathophysiology. The hormonal fluctuation affect the serotonin, dopamine, and GABA pathways that compound with the psychological stresses. Modern medicines include sepia for the emotional indifference, ignitia for the mood swings and suppressed grief, natromune for the silent grief and depression, oramet for severe depression with the suicidal tendencies. Next, one of the important system in the body is the gastrointestinal and metabolic system. So, in menopausal age group, due to the deficiency of estrogen, there occurs a problem with the gut mobility. Okay, most of the symptoms experienced by the postmenopausal age group is constipation. Okay, in most case, that is in 70% of case, it will be constipation, and in remaining case there will be constipation with the diarrhea will also be there, and also metabolic syndrome. Metabolic syndrome, it is also known as syndrome X. It has a group of different symptoms. When we are dealing with this metabolic syndrome, it is it is a complex disorder. Metabolic syndrome, especially for metabolic syndrome, it has a type 2 diabetes will be there, heart disease will be there, and stroke will be there. Along with the abdominal obesity will be there, the fasting blood sugar will be more than 100, BP will be raised, and the amount of triglyceride will also be raised. Then insulin resistance is one of the important factor for this metabolic syndrome. Then obesity weight gain is also seen in metabolic syndrome. So only after the correction with the constitutional medicine, it will lead to the cure of the patient. Then weight gain will be there, abdominal bloating will be there, constipation will be there, metabolic syndrome will be there, along with the dyspepsia will be there. The patient will experience dyspepsia and cannot eat.
Excuse me, Dr. Amrutha, only 5
So,
minutes remaining.
so the
Only,
reduced
only 5 minutes remaining, doctor.
okay, sir. So the main pathophysiology is reduced estrogen. Due to lack of estrogen activity, it affects the gut mobility. So the main symptoms include dyspepsia and indigestion. The dyspepsia and indigestion, the patient that's like the symptoms of lycopodium. The patient will having a satiety, easy satiety, and when the patient eat something, it will be the sensation of fullness in the abdomen. Then is there will be gastroesophageal reflux disease will be there, constipation, IBS will be there. The important thing is gallbladder. There will be a frequent attack of the gallbladder stone. Increased tendency of stone formation will be there due to high cholesterol metabolism in the body. Naxomica, it is one of the important medicine for indigestion acidity. Then lycopodium for the flatulence. Sepia for the hormone-related digestive disturbance and abdominal bloating. Carbovage for the flatulence and bloating sensation. Pulsatilla for the indigestion from fatty foods, and natramur for the chronic constipation, abdominal cramps, and chelidonium mainly for the liver and gallbladder disorders, chelidonium and cardus. Next, one of the system of the body is the skin and the integumentary system. There will be dryness of the skin along with the wrinkling and premature aging. Okay, uh, there's other skin complaints in the old age. Mainly, the amount of estrogen in the body will be reducing, and it ultimately lead to the skin follicle. Usually, estrogen will help in hair follicle to support in the growth, and reduced estrogen will lead to all the symptoms. There will dryness of the skin will be there, pruritus will be there, loss of elasticity will be there, then pigmentary changes will be there. The melasma like symptoms like will be there. There will be discoloration on the face, especially what we study in sepia, that is a telltale face of the uterine metals like that. Then delayed wound healing will be there, allergic disorders will be there, hair falling is one of the important problem, and unwanted facial hair hirsutism will be there. One of the important medicine is Oleum jacorosaceae, 30 potency. It can be given for unwanted hair growth. Then nail changes, there will be nail will be brittle. Then important our medicines include sepia, natramur, sulfur, graphitis, lycopodium, thuja, and phosphorus. Then endocrine system, we will experience thyroid dysfunction, maybe hypothyroidism, reduced immunity, and chronic fatigue. The main pathophysiology is the altered metabolism in the hypothalamo pituitary ovarian axis. Then adrenal imbalance will also be there. Mostly weight gain is occurring in menopausal couple. Sepia, calcareca, placosis, sulfur. So as we are having a limited time, I'll be winding up shortly. So menopause is supposed to be a period, okay, 45 plus or 40 plus is supposed to be a period. So the woman is supposed to train in their 35 plus or 30 plus. Okay, they are having some sort of complaints, that is a postmenopausal the menopausal complaints they will be experiencing in that sorts of age group. So just like when we are saying that like that prevention is better than cure, just like that. So before menopause, before reaching the menopause, there is a three phases there: perimenopausal period, menopausal period, and postmenopausal period. Perimenopausal period means before the menopause. The patient will experience the hot flashes, irregular bleeding activities, just like that. In menopause, this the period that we discuss now, and the postmenopausal period, the patient will experience different sorts of symptoms. Postmenopausal period usually occurs 1 year after the cessation of menses. So we have to give the patient the emotional support, and also we have to plan the patient with a healthy lifestyle, with the regular activity, balanced nutrition, good quality sleep, and also reduce the stress level. So first thing is protein intake, mainly 0.8 to 1.2 gram protein has to be taken daily. Mainly the legumes, pulses, dairy nuts.
Excuse me, Dr. Amrutha, it's 9:30. Please conclude.
Okay, sir. So these are the things we have to eat. Then micronutrients, calcium, vitamin, magnesium, B complex. Then plant-derived estrogen also important. And fiber-rich food and also hydration. So physical activities and aerobic exercise also important. And mainly it has a we have to advise them for a regular sleep pattern, good sleep pattern for the patient, and reducing the stress, and we have to encourage the patient with a good emotional and social support. So these are the important tests that we can commonly do for a postmenopausal woman, that is a menopausal age group, and postmenopausal group, that is in hematology we can check for the CBC, ESR, CRP. Hormone we have to check for LSH, FH, and TFT. Metabolic check for the FSH, PPBH, FPS, HbA1c. Then bone system check for the calcium, vitamin D, and alkaline phosphatase. Immune factor check for RF, ANA, and anti-TPO. Then vitamin B12 and ferritin is also important. Then one of the important condition is, I will just find out now. One of the important condition is postmenopausal bleeding. Okay, the postmenopausal bleeding is after menopause, the patient may experience bleeding continuously. This can be considered somewhat one of the serious condition. The common causing route.
Dr. Amrutha, you can have another session, please.
Okay, sir. Thank you all. Thank you for giving me session.
It's
Yes,
always
yes, definitely. It was a yes, Dr. Miss Arya, you can conclude the session.
Yes, thank you, sir. So thank you, Dr. Amrutha, for such a wonderful session. I am concluding this session since we are short of time. I thank all the participants in this webinar for having their time spent with us. Thank you. Thank you, everyone.